Welcome to aminacademy.com in abnormal psychology regarding somatic system disorder. Some case studies you can do. Somatic symptom disorder happens when a person feels significantly distressed about physical symptoms and has abnormal feelings and behaviors in response to them. These responses interfere with their daily functioning. The physical symptoms may be due to medical conditions or have no clear causes. Somatic symptom disorder (SSD) is a mental health condition in which a person feels significantly distressed about physical symptoms and has abnormal thoughts, feelings, and behavior in response to that. The disorder disrupts their daily functioning and quality of life. Although a person with somatic system disorder somatic symptom disorder reports symptoms. The symptoms may have no medical explanation or be normal body sensation or discomfort. Even when there is a medical cause, the person's worry is about out of proportion to the symptom. People with somatic symptom disorder are often unaware of their underlying mental health conditions and believe that they have serious physical ailments. The distress often causes them to visit multiple healthcare providers and to have many medical tests and unnecessary procedures. Now we'll discuss further detail about somatic system disorder. Somatization disorder involves unexplained physical symptoms and recent diagnostic shift to somatic symptom disorder (SSD) now emphasize the individual's excessive thoughts, emotions, and behaviors related to those symptoms. Case studies highlights the challenges of diagnosing SSD as patients often present to primary care with symptoms like chronic pain, gastrointestinal issues, or neurological problems, prompting extensive but ultimately negative medical workups, a process detailed in examples of such as Mia presenting the persisting vomiting or Mr. Capek experiencing chronic fatigue and dizziness in case studies. Somatization disorders are mental health conditions where people experiences a significant distress from a physical symptoms that have no clear medical explanation, leading to excessive worry, thoughts, and behaviors about their health. Symptoms can include chronic pain, digestive issues, fatigue, or neurological problems, and the conditions is characterized by a prolonged preoccupations with the health concerns despite repeated negative medical findings. Treatment typically involves psychotherapy and medications to manage the underlying psychological distress. Understanding the conditions. Some definitions. Somatization disorder or Briquet's syndrome is characterized by multiple recurrent unexplained physical complaints in multiple body systems beginning before age 30. Diagnostic shift. In the DSM-5, the disorder has been replaced by somatic symptom disorder (SSD), which requires the presence of at least one physical symptom accompanied by excessive and dispro- disappropriate, disproportionate thoughts, feelings, and behaviors related to the symptoms, regardless of whether a medical conditions exist. Common presentation: patient often experience chronic pain, gastrointestinal issues, fatigue, or pseudo-neurological symptoms, leading to frequent doctor visits and medical tests with no clear psychological issue causes. Next, case studies of examples. Mia, a 15-year-old, presented with flu-like symptoms and blood in her vomit, leading to an initial suspected diagnosis of appendicitis. Extensive diagnostic testing in the hospital, including MRIs and CT scans, returned normal results, underscoring the need for psychiatric evaluation in such cases. Mr. Capek, 68-year-old man, presented with fatigue, headaches, and chest tightness, but extensive testing for heart diseases was normal. Despite the lack of clear physical cause, he denied symptoms of depression or anxiety, illustrating the difficulty in diagnosing the disorder. Mr. X, an individual with a history of chronic Lyme disease, complaints, presented with fatigue and headaches, prompting a psychiatric consultations. His symptoms were evaluated by a psychiatrist who noted that these episodes often coincided with stress, suggesting a somatic components to his physical complaint. Implications of case studies. Diagnostic dilemma. These cases highlights the challenge for healthcare providers. A patient with somatization symptoms are more likely to seek help from medical specialists than from mental health professionals. Importance of an integrated approach. Early and accurate diagnostic is a crucial as a thorough interdisciplinary evaluations by medical and psychiatric professionals can reveal that symptoms are somatic in origin, leading to more effective treatment. So far, we discussed about abnormal psychology in that somatic system disorder. Some case studies we have done. Please subscribe our YouTube channel.